Hello, my name is Jackie Knopf. I currently work in Same-Day Surgery as the clinical nurse educator. We're here today at the nursing research seminar to talk about distraction therapy. Members of the team that I'm on for our project was myself, Marsha Artis, who works in PACU, Bethany Wheeler, the manager of Same-Day Surgery, Sandy Huff, and she is a frontline staff member of Same-Day Surgery, Christy Floyd, also a frontline staff member of Same-Day Surgery, and Angie Pod, who worked as our mentor. I'm sorry, clicked there too many slides. We, as a group of nurses in Same-Day Surgery, decided to become certified in peri-anesthesia nursing. When we became certified in peri-anesthesia nursing, we went to a national seminar, it's called CAPA, from ASPAM, which is the American Society of Peri-Anesthesia Nurses. We went to a seminar in Indiana, and this was back in 2017. Some of the nurses went to one of the meetings where nurses had presented a distraction therapy. They gave iPads to their pediatric patients rather than giving oral Versed to decrease anxiety. When our nurses heard this, we thought that was a very good idea. They really liked it. There was lots of research that the team had presented on it when we were at the meeting. When we came back, the nurses continued to talk about this, and they were talking to Dr. Shahady about maybe trying this with his patients because he had the majority of the pediatric patients. Dr. Shahady was very interested in also doing this. He did not want his patients to be too sedated prior to going to surgery. So he thought this was a great idea. He did some research of his own on it and found that there were lots of research stating that this was an approved method of taking care of the patients. So we decided to go ahead and get on board with this, and we started our project.
Hi, everyone. My name is Christy Floyd. I've been a nurse here at Southern High Medical Center for approximately 32 years. 26 of those I worked labor and delivery, where I had lots of experiences with families. The last 6 I have worked in same-day surgery, and I enjoyed participating in this study. It was exciting to see the children react with the LEAP pads for the first time. And it was a very good learning experience for me. It was my first time participating in such an event, so I found it very rewarding. Talking about current evidence, the nurses and Dr. Shahady's literature search found that distraction therapy, if provided to children in the preoperative period, greatly reduced their anxiety. And we understand that at times anxiety and pain medications are needed, but we wanted to know if we could achieve the same outcome and decrease the amount and frequency of the narcotics that we were giving to the pediatric patients. Studies have shown that pediatric patients do have better outcomes with behavioral interventions. Traumatic experiences during the preoperative phase can have lasting effects on children. Unfavorable experiences in this phase can create fear towards medical systems for a lifetime, but they can also sometimes lead to serious psychological consequences like post-traumatic stress disorders. Changing practice. After gaining the approval of the anesthesiologist at Southern High Medical Center, same-day surgery began using our LEAP pads on February the 12th of 2018. And the same-day surgery staff shared with us that the pediatric patients seemed to love the LEAP pads, and they were very effective to keep them calm prior to being transported to surgery. The PACU staff also shared that the patients would wake up easier, they were asking for their LEAP pads, and the nurses wanted to determine if there were other benefits that could be gained by the use of these LEAP pads.
Hello, I'm Sandy Huff, and I'm a nurse here at SOMC. I've been here a little over 20 years, and I've been in same-day surgery for 7 years now. This is my first time participating in a research study, and I really enjoyed it and learned a lot about it. And I'm going to talk about research. Sometime after the implementation, same-day surgery and PACU nurses decided to complete a retrospective study. For those of you unaware, a retrospective study looks at data from events that have already occurred. This was a great learning experience for each of us. Angie Hodge was our mentor, but this was the first time for the rest of us that have participated in research. Each of us completed education. We submitted the proposal to the research team. We also worked with Roy Phillips, who is a member of the IRB committee. With his help, we completed the IRB application.
Hi, I'm Marcia Artis Smith. I am the nurse manager at the Southern Ohio Medical Center's PACU. For some of you that don't know what PACU stands for, it's Post Anesthesia Nurses Unit. And I've been at SOMC for 31, I'm starting my 32nd year. This is my first research project that I have been in. So this was very educational for me. With this being a retrospective research study, we were somewhat limited to what we could measure. We had to choose things that we could measure and collect data from, which was our electronic medical record. We looked at the amount of time that passed, the separation time that the pediatric patients were separated from their parents. We looked at the time that the patient was in the recovery room. And then we also collected data on the postoperative pain medication, if any was given. So I encourage you to consider when implementing a change in practice, make sure that it's things that you can measure. The data that we collected was pediatric patients aged 2 to 12. They were all ENT patients. All were getting an ear, nose, or throat procedure here at SOMC. We used records from September of 2017 through August of 2018. To provide confidentiality, we made sure that we did identify these records and kept those records in a secure place. The data was collected and it was summarized for these timeframes. The summary was sent to a statistician who used the Mann-Whitney-U test to evaluate the results.
Hi, my name is Bethany Wheeler. I started my career at Southern Ohio Medical Center 14 years ago on what's now called Progressive Care Unit. I've spent the last 8 years at SOMC in the role of nurse manager in same-day surgery. Like everyone else has mentioned, this is my first time being involved in a research project, and I just have to say that it was a great learning experience for all of us. And all of the team members did a great job doing hard work to collect this data. And a big shout out to Angie Hodge and Roy Phillips for being our mentors and helping us through the IRB approval process. If you've not been through that before, definitely reach out to someone to help you through that. And it was a really great learning experience. I'm going to be talking to you guys about the summary of our research project. So if you want to take a look at the graph here on the slide, if you look at the blue columns, that represents our pre-implementation data, and then the red columns represent our post-implementation data. So just a quick review on what we actually measured, the things we wanted to see, did this get better or not with the LeapPad implementation, was the average time that was spent in recovery or in phase 1 in PACU. And then recovery is also split up into phase 2 and same-day surgery. So did they spend, less time in PACU or in same-day surgery? Then if you put those times together, was their average time decrease in their total recovery? We also wanted to measure the average time the pediatric patients were away from their parents, and to take a look at the percentage of patients that required postoperative pain medication. It may be a little hard to tell exactly what these numbers are, so to tell you a little bit about that, after our implementation, the total time in PACU actually increased by an average of 1.82 minutes. The total time away from the parents also increased by an average of 2.77 minutes. However, if we look at the total time spent in phase 2 recovery and same-day surgery, that decreased by an average of 5.52 minutes. And the total time, if you add all recovery time together in PACU and same-day surgery, also decreased by an average of 3.75 minutes. Another set of data we looked at was the patients that required postoperative pain medication. So pre-implementation, we had 12 of 71 patients require something for pain, which equaled an average of 16.9%. Post-implementation, there was a slight decrease to 16%. We had 12 out of 74 patients require something for pain in that group. These differences weren't a whole lot and weren't really what we were expecting to find. But overall, we were still happy with implementing this in the study because we were able to decrease Versed administration preoperatively. We were able to see the differences in our pediatric patients waking up happy, asking for the LeapPads, and they really seemed to do well with that and have less anxiety. With this being a retrospective research study, that is one thing that we would have liked to have measured that we were unable to. We weren't using a tool to measure anxiety preoperatively or in the PACU when we implemented this. So pre-implementation, we wouldn't have had that data because nurses weren't documenting that. And the same thing post-operatively. So one thing I would encourage everyone to do, if you're thinking about doing some kind of research project and you have a planned change in practice, I would encourage you to put a lot of thought into, before you make that change in practice, what are the things that you want to measure? And that way you could look at doing a research project that isn't retrospective, and you may be able to gather more data and find out more things that you want to find out through your study that you can't go back and redo if you implement things before you have those pieces in place. Our next slide shows a visual graph of our statistical analysis, which I'm going to do my best to give a good description of. This is where things get a little bit more difficult for me because I'm not a research expert. But what we use, someone referenced earlier, is called the Mann-Whitney U-test. And that's basically a statistical test that's used to compare differences between two independent groups when the dependent variable is either ordinal or continuous, but not normally distributed. So for this research study, we didn't know what we were doing this ahead of time and have a control group and all that. So we were basically comparing pre-implementation data to post-implementation data, and our number of patients we were evaluating were different in that group. So when you use this test, you come up with what is called a p-value. So the great thing is we had a statistician do the statistics pieces for us. So if that's a piece that's scaring you away from research, I would encourage you to press on and just reach out to your resources and have someone help you with that piece. So the big thing to know is when you get those results back, what you need to look at is called the p-value. So if the p-value is less than 0.05, that would indicate statistical significance. So in the summary, you can see numbers, straight numbers, did things get better or get worse? But the statistical analysis is what will tell you if that change is statistically significant or not. So our p-values were up and down. This blue column represents that 0.05. The time in phase 1 p-value was 0.9. The time in phase 2 p-value was 0.58. And the time away from the parents was 0.7. So even these topics that we did see some improvement in, they were not technically statistically significant. But again, we did see some improvements, and overall, we are still very happy that we implemented this best practice. We didn't see all of the improvements in different areas that we thought we might see, but some of them did improve. So that was really great. The next slide has our list of references, which is what we looked at a lot prior to implementing using the LEAP pads in place of the oral versed ed. So it was really an established best practice. And these are just the resources that we looked at for that. Again, everyone that was involved in this research project did a great job, and we really appreciated the support. We had lots of questions along the way, and we just encourage anyone that has a question, you know, if we do this, will this make something better? To just put a lot of thought into what you would like to measure and reach out to your resources to maybe help you get a project going as well. I'd be happy to help as much as I can, or if I don't know the answer, I can at least point you in the right direction of someone that probably could. And if you guys have any questions about our project or could use a point in the right direction to get something started, you can give me a call anytime. My extension's 8525, and we hope you guys enjoy the rest of the Nursing Research Symposium.